Hi, I'm Chuck Bassett. I'm Vice President of Government Relations for Blue Cross Blue Shield of Arizona. We expect the impact of this legislation to be felt by all Americans, and small businesses in particular are going to feel a lot of impact from it. First of all, they're going to see cost impact. This legislation contains provisions that increase access to health insurance for a lot of Americans, but it doesn't focus on the other problem, which is cost. In fact, it focuses so much on access that we're concerned that it's going to add to the cost problem. We are also going to have to cover more services, but there's going to be less cost sharing involved. And when you do that, if there's less cost sharing, there's going to be more premium. So that's another factor that's going to add to cost increases. There are a lot of tax provisions in this bill, and some of those are going to go to the bottom line as well. And just for example, there is a $14.3 billion assessment on the insurance industry each year under this legislation. We've analyzed what the impact would be on Blue Cross Blue Shield of Arizona, and we think it's going to add $42 million to our tax bill every year. That's a lot of money. There are similar taxes on the device and drug makers, and all these taxes are going to find their way into the bottom line, and that's a big concern for us. There is some help in here for small, low-wage employers. If you have fewer than 25 employees and your average salary is less than $50,000, you can qualify for a tax credit that can help you afford your insurance premiums, up to 50% of the premium over time. So there's a lot of cost. We anticipate a lot of burden for small businesses, but there may be some good parts for small businesses too. We're so focused on our cost concerns, but we do need to step back and recognize that there are going to be some positives here. The bill places an emphasis on wellness and prevention, and I think that's key, especially in this environment where we're seeing a real increase in obesity and some of those terrible chronic conditions and expensive conditions that go along with obesity. It recognizes that health information technology is going to be an important benefit down the line. If hospitals and physicians and insurance companies can all communicate more effectively, we can have medical records online and improve outcomes as well as decrease costs. Now, I think there's going to be a lot of cost up front, but in the end, I think that's going to help out with costs. We're also going to see some benefits for people who are uninsured right now. People who have serious pre-existing conditions who can't get coverage may see some benefits, and coverage may open up for them. Small businesses with older and less healthy employees may actually see their rates decrease under the legislation. Now, the other 90% are going to see their rates increase, but there will be a benefit for that group. If you're like me and you have older children, you may be benefited by the new language that allows you to keep dependents on your policy until age 26. And interestingly, they can even be married under that provision. Unfortunately, for most people, I think this is going to be a story of higher costs, and that's going to be the consumer impact. There are disincentives under this legislation for younger, healthier people to buy coverage. And of course, those are the people you need to balance out the insurance pool. So that's a big concern. We're still sorting through the 2,700 pages of changes, and it's early on yet, but we're getting a bad feeling about the cost impact of this legislation at this time. This federal health care reform legislation is really an extreme makeover for the industry, and it's a very expensive makeover. In my career as a lawyer and an insurance guy over the years, I've seen regulation of insurance transition from exclusively almost state-based to a lot of federal regulation, and this bill just takes it the extra mile. We are going to be an industry that's subject to dual regulation, and that presents, as any business person can tell you, a lot of challenges. It's going to be expensive and it's going to be complicated, so that's one challenge. We're also going to be subject to a lot of new rules, having to accept all applicants regardless of health condition, really severe rating restrictions, and these are things that we're going to have to balance and really try the best we can not to let the cost impact bleed into too much business. We're also going to have a lot of complex new rules, which we're just sorting through now, trying to see the impact of them. And then the deadlines. The deadlines for implementation are coming fast and furious, and they're pretty difficult to juggle. So we have a lot of complexity, and one great example is the grandfathering provision. You may have heard the president say, if you like what you have, then you can keep it. Well, that relates to grandfathering. Policies that were in effect on the date that the president signed the bill are grandfathered. They are, by and large, exempt from many of the changes. But unfortunately, they're not exempt from all the changes, and over time, they can lose their grandfathered status but we can't tell when they lose their grandfathered status. We can't tell the level of changes you can make to a policy and still preserve that grandfathered status. And it's really important because the people with those grandfathered status have a leg up in terms of maintaining the cost of their insurance. So there's a lot of issues that we're sorting through, and many of them are going to affect the consumer. If Joe Average needs to be aware of one issue in here, I think it's the untold story of the increased cost. There are so many provisions in here that are going to really add to the cost of insurance. The legislation has been focused on access, ensuring that people have access to insurance, which is important, but it's really ignored and even added to the cost problem that so many small businesses face.